Hello and welcome to On Call After Hours, where we answer the questions we weren't able to get to during our regular show tonight. All of your questions are important to us. We want to answer them as many as we can for you. So let's go to the first question. Discuss GPA and kidneys. I think that's Wegener's granulomatosis.
I'm not sure, but the newer term for Wegener's is granulomatous polyangiopathy.
That's GPA.
So I think the caller is talking about that. So that's a disease of inflammation of the blood vessels due to certain antibodies attacking the blood vessels, and the kidneys and the lungs are the most commonly affected.
Sinuses sometimes?
Sometimes sinuses, yep. Untreated, it's 90% lethal, 85% lethal. Treated, there's generally a good outcome unless it presents too late. If there's advanced kidney disease, then the medicines can save lives, can stop the bleeding from the lungs, but might not save the kidneys.
Okay. Julie? That's about right? All right. Discuss gout. How does 300 milligrams of allopurinol for gout and creatinine affect kidney function? Julie?
Usually someone with gout, it usually doesn't affect the kidney function. If someone has an acute gout, it could cause a mild increase in the creatinine, but usually it's not something that could damage the kidney. But definitely someone with a gout, I mean, it needs to be treated or at least try to lower down, because eventually it's more of related to the heart disease more than destroying the kidney.
And there's some things about kidney stones brought on by uric acid crystals, so higher stone incidence. But allopurinol is toxic to the kidney.
Not really, no. In kidney disease, there are higher levels of allopurinol when you take allopurinol, but the latest recommendations are to take to monitor the uric acid and take the proper amount of allopurinol that controls the uric acid, even in the presence of kidney disease. There may be other side effects of allopurinol that are a little bit higher in kidney disease, but you just have to monitor it.
But kidney disease does not mean you don't use allopurinol.
Absolutely correct.
But there is a new drug, Uloric is the brand name. I can't remember what
a few less side effects, but very expensive. And if you can get by with allopurinol, you probably should get by with allopurinol.
There's some bone marrow problems with allopurinol.
Right, right. And that is a little bit higher likelihood in the presence of kidney disease, but it shouldn't block you from using allopurinol. Now, high uric acid, which causes gout, is associated more commonly with chronic kidney disease, but the cause and effect, as Julie said, is not very tight. Well, it's not very tight, and we haven't really been able to show that if you take allopurinol and lower the uric acid that it does anything for chronic kidney disease.
Okay. Please discuss peritoneal dialysis. Caller felt better on peritoneal dialysis than renal dialysis. Julie.
So we have two forms of dialysis. So we have what they commonly call the hemodialysis, or known as the layman term as dialysis, and there's what we call the peritoneal dialysis. So dialysis is the one that we're using the machine, just like what has been shown a while ago, and then there's what we call the peritoneal dialysis. So peritoneal dialysis, it's like a pipeline in the belly. So we're going to put a fluid in the belly, and then that fluid will be sitting in the belly for some time to get rid of those toxins, to get rid of excess water, and then after which it's being drained like into a tube out of the belly.
So they bring in all of this juice that has just the right mineral concentration, so it'll draw fluid in and get rid of poisons in water, and then you dump it out and you just run it in again and dump it out, and they can do it at night when they're sleeping.
Right. Clean fluid in, dirty fluid out. And it becomes automated. It's not as crude as it sounds when we're talking about it.
Yeah, it's a really good. The only major problem is what? Infection?
Yeah, but that's minimal now. Yeah, it's a very good treatment. Yeah, people don't have to spend 4 hours 3 times a week in a
especially
unit.
Like the young ones or those who are working. At least they have more like lifestyle. They could do like their usual routine in the morning up to the afternoon, and they'll just go to sleep, have the peritoneal dialysis done.
The machine just kind of does the whole...
Anybody who needs dialysis should at least know about peritoneal dialysis, because many people would benefit from it, and some people like it much, much better, and some people feel better with it.
Well, because it's more effective? Or?
No, people can retain their independence. They do it at home. You don't have to come to a center. You don't have to drive. Don't have to sit there for 4 hours.
Here's a question about having 4 kidneys. People have double kidneys, 3 kidneys, 4 kidneys. You ever heard of that?
Yeah, supernumerary kidneys. It's not an important issue.
It's not dangerous?
No.
All right, so not an issue.
Not an issue. And most of the time you really don't have 4 kidneys. You might have 2 of those ureters that come down from 1 kidney, or partially separated, just like the horseshoe is connected. And
just a kind of a congenital
variation.
Variation in shapes and so on and so forth.
Right.
All right, so any take-home messages that Julie, that you think we need to make sure that people heard, that we didn't get to tonight? Something about dialysis or transplant?
Mm-hmm. I think I want to talk more about chronic kidney disease than transplant, because when we say transplant, that means that they're already at the end stage of their kidney life, or the kidney already failed. But I think for someone who has chronic kidney disease, I mean, the key thing is the lifestyle. I mean, like the proper food that they need to eat. I mean, for someone with high blood pressure, for those who have diabetes, the key thing is to control the high blood pressure, to control the diabetes. And I mean, the kidney problem is because of something else, and it's not the kidney that is causing the disease itself. So there's really nothing that we could, or a medicine to give the kidney, which is, I think, is a common question. Is there a medicine for the kidney? So it's really controlling the cause or the root of the problem itself to take care of the kidney.
Okay. And Bob, any
I would say take it seriously and become educated and take control of your lives and your bodies, and like Julie was saying, and become educated. If you have chronic kidney disease, listen to your doctor, go online to reputable sites, ask questions. If you need dialysis, find out the types of dialysis. Become educated about transplant. Just empower yourselves. I mean, the knowledge is out there.
All right. Well, thank you for joining us on our website. We appreciate all of your questions and the opportunity to answer them. Be sure to join us next week on South Dakota PBS at our regular time, and call in or email your questions. And until next time, stay healthy out there, people.